Welcome to the video on joints. So there are three basic structural types of joints. The first is fibrous, so this is a suture in the skull. These are made of fibrous tissues. These are very strong but don't allow any movement. Then next we have cartilaginous joints made of cartilage. So the pubic symphysis or the discs in between your vertebrae are examples of cartilaginous joints. These are not as strong as fibrous joints, but they allow more movement. And then finally we have synovial joints. These are our most common type. These are freely moving. They have a joint cavity, and these are found in most of your long bones. So if you're not sure, guess synovial. Then we need to know the structures found in a synovial joint. So this joint here is actually from in between your fingers, I believe. And you can see around the outside there's a joint capsule, which just kind of holds everything together. There's the synovial membrane in that darker purple there that surrounds the whole joint, and it makes the synovial fluid. The joint cavity is the space in between the bones, and it is filled with synovial fluid, which makes it so the bones can easily move. Articular cartilage is found on the ends of each bone. In case the bones do touch, there is articular cartilage there, so that's a smooth surface. Then we have ligaments around the very outside holding the bones together. And then a bursa is found in some synovial joints. In the shoulder example, we can see a couple of bursa. So anywhere where you would have a tendon and a ligament, or a ligament and a bone, or a ligament and a ligament that would be rubbing together, we put a bursa sac there, and that reduces the friction. The joint that is most likely to suffer a dislocation is the shoulder. It is your most freely movable joint, but it's also kind of the weakest, so it's the most likely to be dislocated. So here is the knee joint, probably the most complex joint in your body. And you can see it's made up of several ligaments around the outside and in the middle. And because there's not a lot of muscle around it, it can be easily injured. Some of the injuries, like we see the torn anterior cruciate ligament, that's the ACL for short. Or we can see a torn meniscus there. A meniscus is a little pad that the knee has. Or we can see the tibial collateral ligament, that's also known as the LCL or the MCL. Alright, next thing is arthroplasty. It's a surgical procedure that replaces a diseased joint with an artificial device or prosthesis, or more commonly known as joint replacement surgery. And this is commonly due to osteoarthritis. Then arthritis is simply inflammation of a joint. Osteoarthritis is commonly called wear and tear arthritis, a common effect of aging. So we're not meant to live forever. Rheumatoid arthritis is an autoimmune disease where your body's antibodies attack the synovial membranes. That leads to a degeneration of the articular cartilage and thickening of the synovial membrane, and then pain, inflammation in the joint. And next thing is how regular exercise protects articular cartilage. So you might think resting joints helps them, but because the cartilage doesn't have much of any blood supply, it depends on the synovial fluid for oxygen and nutrients. And during exercise, as you compress the joints, that squeezes the fluid and metabolic waste out of the cartilage. And then once the weight's removed, so for example, when you're running and you put all your weight on one foot, that's going to press down on the cartilage and squeeze the fluid and waste out of it. And then when your weight is shifted to the other foot, that cartilage can soak up synovial fluid like a sponge. So the periods of compression and relaxation during exercise causes the synovial fluid, along with its oxygen and nutrients and phagocytes, to cycle through the cartilage. So exercise actually helps prevent joint damage and is good for you.